My name's Matt Cheney, and I work at the Cancer Care Center as a radiation oncologist. While I was in graduate school, my dad was diagnosed with metastatic melanoma, and he underwent radiation treatments as a component of his therapy, and that certainly was my first introduction to the field itself. And I was very impressed by how much the radiation oncology team could do for my father with very limited toxicities compared to other treatments that he'd been through. I have not been a patient myself, but having seen my dad go through many different sorts of treatments, interacting with his healthcare team, physicians, other providers, I certainly during that experience took away positive aspects of how he was cared for, as well as some aspects that I wish could have been done better. And I try to always remember what my father would have wanted and what I would have wanted at that time as a family member when I'm seeing my own patients and recommending treatments. I think that there are many things that the patients and their families should expect from care here at the Cancer Center. And there are many aspects of what we do here that make us unique. I think first and foremost that patients and their families should expect to get the highest level of possible care using evidence-based, up-to-date treatments available, and we do an excellent job of doing that. I think that they should expect to be treated not only professionally but also as members of our family here at the Cancer Center, and should feel very comfortable asking any of us any questions that they have, addressing any concerns they may have, and really, making sure that they fully understand the treatment that we're recommending and delivering, and that they feel comfortable with the recommendations that we've made. I think back to my father's experience and how important it was for him to understand why a certain treatment was recommended. And so I think that all of us here at the Cancer Center do make a good effort to make sure that those concerns are addressed. I think that what makes us very unique here is that we're able to offer patients a very, very high level of care with very well-trained staff and providers, using the most technically advanced equipment that's available in a community setting that's close to home. Radiation treatments are delivered usually over a period of weeks, and to travel an extended distance each day back and forth while undergoing cancer care, often with concurrent chemotherapy, can be very, very challenging emotionally, physically, and from a financial resource perspective. And I'm very proud to be able to offer care here in York County. There are many things I get excited about. The technology that we have available to our patients here, we're continually upgrading our radiation planning equipment, our radiation delivery equipment, and are able to offer patients state-of-the-art treatment on the most advanced possible machines with very high-level technology. In very recent years, we've transitioned from two-dimensional plain film-based treatments to very advanced CT-based or MRI-based three-dimensional treatments, allowing us to target cancers with pinpoint accuracy while sparing the nearby adjacent tissue, which lets us deliver a higher dose of therapeutic radiation to our patients' cancers while minimizing the long-term and short-term risks of toxicity. So as time goes by, our ability to treat a broader array of cancers is exciting. And our ability to achieve better outcomes is very encouraging. My first impression of the Cancer Center was that it's such a welcoming, warm place. I think that the center has done a wonderful job of making everyone who walks through the door feel comfortable as possible. Understanding that many people walking through those doors are dealing with very difficult emotional and physical situations. But my first impression was certainly just one of welcoming and warmth. The medical community here is very strong, and I feel privileged to be a part of it. We form one large, cohesive team that works together to provide our patients with the highest quality level of care. We're constantly in contact via phone, email, or in person to be sure that we're each up to date on our patient's progress and to discuss the next steps in treatment. The staff here are incredibly caring people, and so as a result of that, the care that's delivered is seamless in my view, and they treat each patient as though they were family. There are many things about being a radiation oncologist that are inspiring, but certainly my patients are what inspires me and makes me excited to walk into work every day and makes me continue wanting to work hard and be here to deliver even better care tomorrow than I did yesterday.